Welcome back to our half-hour special. We're live with Dr. Stephen Thomasuni, Upstate's Chief of Infectious Diseases. Dr. Thomas is answering some of your most asked questions about the COVID-19 vaccine. So let's get back to it. Are you concerned about COVID scams, Doctor? With so much misinformation out there, what do people need to watch out for?
So I think people need to understand that there is a staggered approach to rolling out these vaccines. And, the first group of people who are getting vaccinated are frontline healthcare workers, people who are taking care of COVID patients, people working in emergency departments, ICUs, people who are responsible for maintaining the cleanliness of those rooms and delivering items to those rooms, et cetera. And then also people who work in long-term care facilities and the residents of those long-term care facilities. So that's about 24 million people in the United States, and we don't have that many vaccine doses yet. So anybody who gets called or told, it's your turn for a vaccine and you don't fall into those categories, you probably shouldn't believe it, because it's probably into the next year when we start getting into those next tiers of vaccine allocation.
A lot of people want to ask you who can and cannot receive the virus. We got a lot of variations of underlying illnesses, conditions that may prevent somebody from getting the vaccine. Are there any conditions that would prevent somebody, some major things that would stop them from getting it?
Yeah, so really the only thing that is an absolute kind of no is people who have known allergies to components of the vaccine. They should not be getting the vaccine. And if you're interested in what those components are, you can go on to the FDA website and you can look up that information. But then there are a lot of folks that would be in the gray area, right? So people that have had severe allergic reactions, so anaphylaxis basically, to vaccines in the past, you should talk to your doctor about that. People who have active medical conditions that suppress their immune system, like cancer, or they have autoimmune diseases that they're taking drugs which will weaken their immune system, those people should have a discussion with their physician. Pregnancy, breastfeeding, the same thing. You need to have a discussion with your doctor, and what you're going to discuss is, what is my risk of getting COVID? What is my risk of a bad outcome if I get infected? And the other side is, what's the risk of the vaccine and the potential benefit of the vaccine in me? And then you make a joint decision together.
Our viewers also want to know, what will be the push for younger children to receive the vaccine? Is that a concern of yours, or is the main focus on the older, more vulnerable population?
So today, the Moderna vaccine got a thumbs up from the advisory committee. That vaccine was only tested in people 18 years and above. Pfizer has been given a thumbs up for children 16 years and older. We are currently enrolling 12 to 15-year-old people in the trial at Upstate. But for right now, the vaccine can really only be used in, only the Pfizer vaccine can be used in young adults 16 and older. And Moderna, if they get a thumbs up from the FDA later this week or this weekend, that'll be in 18 and above.
So maybe just one more quick one on that to follow up. You have always said probably maybe late summer, early fall before we'd have more research guidance on the younger kids, maybe in the 9, 10, 11, 12 range, and even younger.
Yeah, I think that's correct. So, there are going to be studies with these vaccines and people who are immunosuppressed. There are going to be studies likely in pregnant women, and they will probably do what we call age de-escalation studies. So they will slowly go down in age.